do we want? When do we want it? Now. What do we want? When do we want it? Now. What do we want? We want Hooded. We want Hooded. We want Hooded. We want Hooded.
Sisters and brothers Wesley and Nora.
I am here. Thank you guys for coming. We at Sickkids, we're fighting to get a better long-term sick leave. Okay, when our staff are sick, all they're entitled to is $1,000 tax deductible, and we're saying that's not enough. We're saying that Sickkids is one of the world-renowned hospitals, one of the best hospitals in the world, and there's no reason why we should not be treated like every other hospital in this province. We have tried on numerous occasions to talk with the employer about getting a better sick time and have been turned down. So we are saying that enough is enough. We want, when our staff are off sick, that they're not going through poverty, and this is shame on Sickkids. Our staff need to be treated with respect and dignity like every other staff at this hospital.
That's right.
Okay, a lot of us, we have lots of years here, and when we're sick, we should not only be getting $800 a month. That is a shame on Sickkids, and we will not stop this demonstration until they meet with us and give us what we're entitled to, which is other. Which is the sick leave as every other hospital. So Sickkids, until you meet with us to discuss a better sick plan, which is Hooded, we will not stop this demonstration, and we will continue. We want Hooded. What do we want? What do we want? When do we want it? What do we want? When do we want it? What do we need? When do we need it? What do we need? When do we need it? When do we need? When
sisters and brothers, we're not far from Queen's Park. We got a message for sick kids. We've also got a message for Queen's Park. Quit privatizing, fund healthcare. Give these workers a proper long-term disability coverage. This is a world-renowned hospital with tremendous employees, but some employees are being treated like second-class citizens. In QP, there are no second-class citizens. We stand with the workers of sick kids.
Give them what they want!
We also stand here because we care about health care, and you can't have a proper health care system when workers are worried about starving to death if they get sick. I say health care, you say we care. Health care! We care! Health care! We care! Health care! We care! What do we want? When do we want it? Now! They can't hear you at Queen's Park. What do we want? When do you want it? Now! I say health care, you say we care. Health care! We care! Health care! We care! Health care! We care! Stand together and we will get for sick kids, QP members, what they deserve. They are tremendous workers. In QP, you're never alone. We stand with the workers of Sick Kids Hospital. Candice Reddick, Treasurer of QP Ontario. A big shout out for Candice.
Okay, so Jackson and I come here today to stand in solidarity with all of you because not that long ago, I was one of the parents who depended on the workers at Hospital for Sick Children when my son was in crisis. He was in isolation with a highly contagious condition and relied on the safe and proper cleaning of the housekeepers to prevent further spread of his condition. I saw firsthand the care that was taken by cleaners to contain that contamination and to keep it isolated. In my son's case, the condition for him could have been fatal, and each and every time a worker came into his room, they were at risk, yet there was no hesitation. I know that all of you work to provide the highest quality of care to families who are facing difficult times, and it is absolutely outrageous that you have to fend for yourselves in the case of catastrophic illness. You need better sick leave and disability protections, and Jackson and I are here with you today to make that demand. Workers who fall ill are already paying a high price. They should not have to worry about their economic survival as well.
Here, here.
And no worker should be forced back on the job because there aren't enough resources to provide to them financially. I want to say to you, congratulations to all of you, to the members of QP Local 2816 for taking on this fight. Thank you for taking such good care of my family when we were at Sick Kids. And just as you were there for me and my son, we're going to stand in solidarity with you.
Thank you, Candice, here with her new baby. Now, a big shout out, Michael Hurley, President of OCHU. We own this hospital. We built this hospital. We give our sweat and our lives for this hospital. Come closer to it, sisters and brothers. Come closer, come on, let's get up here. Let's bring that speaker back. Now we're doing it, yeah. We may go in. We may go in. We're here today because the women and men who work in support at this hospital, who work so hard at this hospital, when they become ill, with a long-term illness like cancer, they get $1,000 a month. Tax, $800 a month net to live on for months. And why is that? That is so they'll come crawling back to work off the LTE money. That's why this hospital CEO, his car allowance is $16,438 a year, and our members net $9,600 on LTD. You tell me what kind of world this is. We're here today to tell sick kids we had a rally here a month ago in the sleet, and there were 50 of us, and today there's 400 of us, and we're going to be back, and we're not going to rest until there's justice for the staff of the hospital.
When do we want it? When do we want it? Now! As Michael said, we have staff who are sick, and they're forced to come back to work. Okay? And it's just a shame that our staff, cannot be home sick and stay home and live, peacefully. And instead of getting better, they're getting sicker because they have to come back to work. There's no other choices. But we're telling sick kids that sick kids, until you give us HUDIP, we will not back down. Okay? So we will continue this demonstration until our need is met, which is, we're not asking for anything that's unreasonable. We're asking for HUDIP. 95% of the hospital around us have HUDIP, which is a better sick plan. It is safer for us to be off sick, and then we'll get better and come back to work. But when we're forced to come back when we're sick, we are going to get sicker. So we're saying that you're not treating us on this unionized staff and sick kids. You're not treating us properly. And we will not back down from you.
Sister,
you guys,
together we will.
Together we will, as your sign said. Together we will fight. So what do we want? When do we want it? Now! What do we want? When do we want it? Now! What do we want? We want HUDIP. 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 What do we want? HUDIP. When do we want it? Now. What do we want? HUDIP. When do we want it? Now. What do we want? HUDIP. When do we want it? Now. We want HUDIP. When do we want it? Now. We want HUDIP. When do we want it? Now. We want HUDIP. 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 And thank you guys for coming, Julian.
Thank you everyone for coming today. I want to point out a couple of facts here according to what it says on the current benefits for those unfortunate employees of Sick Children's Hospital. Civil commotion. If you cause a civil commotion, you're not covered for sick time. What's that all about? Shame! The CEO, executives, no problem there. They get 75% of their salary. Michael pointed out, shame. $25,000 a month. The fortunate 95% of the members of QP who are covered under HUDIP after a short period of time of 3 months get 66% coverage. You work at Sick Kids for 20 years and you're not even going to get that. You're going to get $1,000 and that's it a month. Did I mention the executives of Sick Children's Hospital? They get their $25,000 plus bonus on top of that. What do they get that bonus for? Cutting back on sick pay. This has got to stop, and we are here today to make sure that all of the staff and the QP staff of Sick Children's Hospital get the same treatment and the same fairness that all of QP members, all of HUDIP members, everyone in Ontario should get the standard
sick benefits. It's a shame that they don't get this. This is an institution that raised $25.9 million last year. So next time, when you're out putting that deposit in when they're approached by an agency worker from Sick Children's Hospital, God bless the children, but you think about where the CEOs are getting all that money and on their bonuses, and it's on the backs of the workers, the ones that show up sick, who come to work, who have to walk away from their disability, even though they've been approved.
Let's go!
They have to come back to work with. They gotta come back after they've had knee surgery. They gotta come back after they have had back surgery because they can't support themselves. It's not for lack of the love of the sick children they care for, but they do it to help their own children so they can survive, so they can get by. This is a shame.
Ontario Council of Hospital Unions, the hospital division of the Canadian Union of Public Employees.